Hello everyone. Today is the last part on injury. In this session, we will mainly talk about several special types of necrosis and another type of cell death, apoptosis. Let's look at a case first. A 48-year-old diabetic developed a non-healing ulcer on his left foot. The foot became black and developed a bad odor. Cultures were positive for anaerobic organisms and gram-negative bacilli. This photo shows his foot. What has happened to this patient's foot? I hope you can answer the question after our discussion today. Fibrinoid necrosis is a special type of necrosis. It can be seen in hypersensitivity and non-immune disorders. This form of necrosis is usually seen in immune reactions involving blood vessels. The site of necrosis can be the wall of blood vessel or in the connective tissue. Fibrinoid necrotic tissue usually appears as eosinophilic and loses its structural details. The term fibrinoid necrosis is used to describe this appearance because it resembles deposits of the blood clotting protein, fibrin. Fibrinoid necrosis typically occurs when there is death of interstitial collagen or blood vessels, such as the damaged connective tissue in patients with rheumatic disease. Here, in this picture, we can see the fibrinoid necrosis in acute rheumatic carditis. Gangrene is necrosis of a large area of tissue followed by infection with putrefying bacteria. In this definition, please note large area and putrefying bacteria infection. Examples of a large area is a whole appendix or a limb. At the same time, putrefying bacteria will lead to the changes in color and characters of necrotic tissue. Gangrene is usually black due to putrefying bacteria infection. Dry gangrene usually occurs in a limb which has lost its blood supply. The patient has occluded arteries but no more venous drainage, and there is evaporation from the skin. Due to desiccation of the necrotic foci, the dead tissue is drier and putrefaction is not severe. Tissue with dry gangrene is of course dry and black. The margin of necrotic tissue is clear. Let's look at the picture in this case again. This is an example of dry gangrene in which there is merely coagulative necrosis from the anoxic and neurological injuries of diabetic patient's foot. This is followed by secondary putrefying bacterial infection of the necrotic areas. Wet gangrene usually occurs in viscera, also limbs with both arterial and venous obstruction, but less common than dry gangrene. Putrefaction is severe due to moisture of the necrotic foci. Toxins from necrosis enter the blood circulation to cause systemic infection, which is clinically called septicemia. These pictures show wet gangrene of appendix. The foci of necrosis are most swollen, foul-smelling, and black. The margin of the necrotic tissue is not clear. Gas gangrene occurs in deep and open wound, complicated by Clostridium perfringens infection, such as those found in soldiers. Deep and open wounds favor the survival of Clostridium perfringens because of the large amount of gas produced by these bacteria. The tissue is obviously swollen. there is crepitus when we feel the necrotic tissue. Crepitus is due to the movement of gas in the tissue. The infection can spread rapidly. Consequences of necrosis include lysis and absorption of necrotic tissue. Necrotic tissue induces inflammation. The infiltrated neutrophils release hydrolytic enzymes to digest the necrotic tissue. Then it can be absorbed through blood vessels and lymphatics or phagocytosed. Small focus can be completely absorbed. Big focus will leave a cyst. Isolation and elimination occur in big necrotic foci located in body surface or organs connected with the outside. This picture shows an ulcer of stomach after loss of necrotic tissue. Necrotic tissue of the lung or kidney can be removed through physiological channels, and the necrotic focus might form a cavity. In this photo, we can see kidney cavities in a patient with tuberculosis. If necrotic tissue cannot be completely absorbed and eradicated, then the necrotic tissue may be replaced by granulation tissue, which is called organization. As detailed in this photo, granulation tissue is merely composed of capillaries and fibroblasts. The role of granulation tissue is to repair the necrotic tissue. A large necrotic area is difficult to be absorbed or organized. In this case, it will be surrounded by a scar, forming a capsule that walls off the dead tissue. This reaction is common in tuberculosis. Such lesions are often calcified. Could you tell which type of calcification it is? Well, it is dystrophic calcification, which we have discussed. Apoptosis can be physiological or pathological. In many normal situations, it serves to eliminate potentially harmful or useless cells. In pathological situations, apoptosis occurs to get rid of the irreparably damaged cell. Apoptosis is a single-cell death and determined by genetic programs within the cell. Apoptosis is regulated by biochemical pathways. The processes involve activation of intercellular enzymes caspases that degrade cellular proteins, and enzymes endonucleases which break out nucleic acids into small fragments. This causes the cells to disintegrate into apoptotic bodies, each surrounded by a plasma membrane. This slide shows us the apoptotic body. The isolated cell becomes shrunken, pycnotic, and intensely eosinophilic. Following apoptosis, the cells are removed by phagocytosis, that is, they are ingested and digested by macrophages in the adjacent extracellular tissue. Please note the apoptotic bodies engulfed by macrophages in the electron micrograph. In this process, the plasma membranes surrounding the apoptotic cells are intact, so there is no inflammation. It differs from necrosis in many respects. This table summarizes and compares the features of necrosis and apoptosis. The presence or otherwise of an inflammatory reaction is the most important difference between them. Let's summarize now. Cell injury occurs when stimuli are so severe that cells are no longer able to adapt. The response to injury can be reversible or irreversible. Degeneration is reversible, while cell death is permanent. Necrosis and apoptosis are two usual modes of cell death. The other two unusual forms of cell death are necroptosis and pyroptosis. Under different conditions, types of necrosis vary and they include coagulative, liquefactive, gangrenous, caseous, fat, and fibrinoid necrosis. Here are the references. That's all for Chapter 1 on cell injury. Next time, we will start a new chapter on repair. Thank you for your attention.